Rockwood doctors are encouraging their patients to go to Deaconess instead of Sacred Heart for hospital care. This comes after Sacred Heart announced last week they're kicking Rockwood doctors out of their offices on Sacred Heart's campus. KXLY4's McKay Allen live tonight. McKay, you spoke with both Rockwood and Sacred Heart today.
I did, and this all started, of course, a couple of months ago when Deaconess, parent company, bought Rockwood. But the big question in all of this, if you're a Rockwood patient who goes to Sacred Heart, what does this mean for you? Sacred Heart and Rockwood agree.
Patients have the right to select their physicians, and that they have the right to select their hospitals.
Patients should be able to choose where they get their treatment.
We will always be committed to our patients, and if our patients say they want to be cared for at any facility, we will absolutely respect that and take care of that.
Historically, 90% of Rockwood's 130,000 patients get their hospital care at Sacred Heart. And there's no question Sacred Heart wants to keep it that way.
I would anticipate that it's somewhere between 20 and 30% of our patients in the past have been part of the Rockwood system.
But now that Rockwood and Sacred Heart's competitor, Deaconess, are owned by the same company, Rockwood says their goal is to get more of their patients to go to Deaconess.
I encourage our physicians, because of that partnership, to when the patient has no preference or when the patient is really willing based on insurance, to absolutely utilize Valley and Deaconess.
But Rockwood's not an insurance company. Rockwood is a physician company. And so, again, I'll go back to patients have the choice.
Bottom line, you can still be treated by a Rockwood doctor at Sacred Heart, and you can be a Rockwood patient and still go to the hospital you want.
At no point, McKay, do you need to hear that have I ever said that our docs must use Deaconess or Valley.
Now, Sacred Heart says neither your care nor your costs will be affected if you are a Rockwood patient. Rockwood says the exact same thing about Sacred Heart. They both say this thing has gotten way too corporate, way too political. They want the focus to return back to the patients they serve. Reporting live, McKay Allen, KXLY4 HD News.